Have you ever gotten your blood test results, you're scrolling through, and then you see it? A little flag, a little asterisk, next to one of the numbers. It kind of makes your heart skip a beat, right? Well, today, we're going to zoom in on one of those tiny cells that can cause some pretty big questions, the basophil.
This right here is a real question, from a real person trying to figure out their own health data. And it's the perfect place for us to start. We're going to unpack what a result like this actually means, what it doesn't mean, and why it's really more of a clue than a final answer.
So there you are, looking at your report. Most of it looks fine, but that one number is flagged. It's a super common experience, and it's so easy for your mind to just jump to the worst possible conclusion. But here's the thing about medicine. A single data point is almost never the whole story. It's just the beginning.
So what are these basophils anyway? Let's break it down. They're a type of white blood cell, which means they're a key part of your immune system's security team. They belong to a family called granulocytes, which is really just a sciencey way of saying they carry around these little pouches, these granules, that are packed with some seriously powerful chemicals.
Okay, so what's their mission? What do they actually do? The best way to think about basophils is to picture them as your body's emergency first responders. They're the fire alarms, constantly patrolling your system, just waiting to sound the alert at the very first sign of trouble.
Now this is really cool. This diagram basically shows the family tree of your blood. Right up at the top, you've got the main stem cell, the great-great-grandparent of all your blood cells. It lives in your bone marrow, and as you follow the different branches down, you can see how one path leads right to our basophils, which then head out into the bloodstream to start their job.
So, what's inside those little pouches I mentioned? Well, think of them as chemical grenades. When a basophil gets activated, it just lets them rip. It releases things like histamine, that's the chemical that causes all those classic allergy symptoms like itching and hives. It also releases heparin, which is a natural blood thinner, and a whole bunch of other signals that basically act like a flare, yelling, "Hey, everyone get over here, we've got a situation."
All right, so now that we know what they are and what they do, we can start to make sense of the numbers on that report. Because to understand what's not normal, you got to know what is normal first.
So here's the deal. Basophils are actually the least common type of white blood cell. They're pretty rare. In a healthy person, they usually make up less than 1% of your total count. If your count creeps up over 1%, that gets the label basophilia. And if it's super low, that's called basopenia. But honestly, that's kind of hard to even spot since the numbers are so tiny to begin with.
Okay, so if your number is flagged as high, like that 2% from our original question, what could possibly be causing it? Why would your body be ringing all these alarms?
This is a really crucial point. Doctors basically sort the causes for high basophils into two big buckets. The first, and by far the most common, is called reactive. This just means your body is reacting to something, like an allergen or an infection. The other bucket, which is much rarer, is called neoplastic, and that points to a deeper issue with how your blood cells are actually being made. Let's look at that first bucket, the reactive causes. Because, honestly, this is where the answer is going to be for most people. We're talking about things like allergies, asthma, skin rashes, you name it. Or chronic inflammation from autoimmune conditions. Even things like recovering from the flu or having an underactive thyroid can do it.
However, if the basophil count isn't just a little high, but it's really high, and it stays that way over time, then doctors have to start looking at that second bucket. Now, we have to talk about this to be complete, but remember, this is the less common scenario. This is when they consider conditions like a type of blood cancer called chronic myeloid leukemia, or CML.
And what causes CML is actually pretty fascinating from a genetic perspective. It comes down to a very specific mistake. You can see it here. A little piece of chromosome 9 and a piece of chromosome 22 literally break off and switch places. This mashup creates a new, faulty chromosome called the Philadelphia chromosome.
I love this little cartoon because it makes it so much clearer. Chromosome 9 and 22 make a trade. The result of that trade is a brand new, broken gene, and this gene basically acts like a gas pedal that's stuck to the floor in your bone marrow's factory, just telling it to churn out way too many white blood cells, including our basophils.
In fact, that basophil percentage is so important in CML that it's actually one of the main things doctors use to determine the stage of the disease. Look at this table. Once the basophil count hits 20% or more of all white blood cells, that's a major sign that the disease is in a more aggressive, accelerated phase.
Okay, before anybody gets too alarmed, let's just hit pause for a second. It is absolutely vital to remember that CML is a rare cause of high basophils. For the huge majority of people who see a slightly high number, the real story is much simpler. So let's get back to that much more common world of everyday allergies.
And check this out, this is so cool. A recent study actually used basophils to help diagnose allergies. They took blood from kids with different allergies and exposed their basophils to cow's milk protein. And look, in the kids with skin allergies, their basophils went way more wild than the basophils from kids with asthma. It just shows you how these cells are right there on the front lines.
So let's tie this all together. We've talked about allergies, we've talked about genetics. What's the bottom line? What should you really think when you see a high basophil count on your own report? If you take away only one thing from this whole explainer, please let it be this. That number is not a diagnosis. It is not the final word. It is simply a clue. It's a breadcrumb for your doctor to follow. You see, a good doctor is never going to look at that basophil number all by itself. No way. They're going to be a detective. They'll look at all your other blood counts. They'll ask you about your symptoms, any allergies, have you been sick lately, and only then, if it's really necessary, will they order more specific tests. They're just putting all the pieces of the puzzle together.
Which brings us all the way back to where we started. That simple question from a worried person online. Is a basophil count of 2% dangerous? By itself, no. A 2% count is a little high, sure, but it's a very mild elevation. Think of it as a signal. It's just a reason to have a conversation with your doctor to figure out the why. And odds are that why is going to be something totally manageable, like allergies, not something scary.
At the end of the day, your blood test is just a story being told with data. Every number is a character, and every result is a little plot point. A single flag number isn't the end of the story. It's just an interesting new chapter, inviting you and your doctor to read on and find out what happens next.